Good to see you.
You
Good.
know, Nick, forget the slides.
Okay.
Let's just talk.
Okay, we're just gonna talk.
We're going to improvise.
We're gonna
Forget the
improvise.
questions you told him. We'll just make them up.
Oh, that sounds. You know what? Then we will do that, but I go first.
Okay, we're unscripted here.
All right.
100%.
But I'm going to introduce you first. All right.
Okay.
So Jess has become a pretty good friend. He is very impressive in a variety of ways. He went to Juilliard for double bass, and then was like, you know what? I'm going to go to med school because that makes sense. And then became a plastic surgeon, and then became one of the world's leading gender affirmation surgeons, where he helped sort of pioneer the practice, and now works at Mount Sinai. And we've gone back and
You know
forth.
what? We'll just quit here.
That's it. Mic drop.
Thank you.
He's done. No, but we've been going back and forth and sort of like how to conceptualize this brief interview. And he sent me slides. And then he's like, "No, I want to change it." And today, I you don't know this part. I had just woken up from a nap, and I got a call from Jess, and he's like, "All right, Nick, forget the slides. This is what we're gonna do. I'm gonna start by asking you what is gender, and then you're gonna answer." And I was like, "No, we can't. I don't want to do that. We're gonna do the reverse." He's like, "That's fine. I know the answer." So that's where we're gonna start. So maybe you can, instead of you throwing it on to me, I'm gonna hot potato it back onto you because you're literally the expert in the room. Let's start because I think your practice is so much centered around this, especially now. Like, how do you think about gender, and we'll sort of evolve from there.
Okay, well, I'll throw it to you guys. I mean, what is gender, right? What is gender? What is sex? We think about gender, we think about our bodies, right? It's my genitalia, whether I have a uterus, a vagina, penis, testes. But as a surgeon, and I've now done like 3,000 of these operations, I know that can change. I could take you, and in 3 hours, you would have a vagina.
He says this at all of my dinner parties, and it terrifies me. It scares me so much.
In 17 minutes, I could have you dismantled.
Can we pay for it?
Yes, and you know what? You can even watch if you pay enough. But Nick, when you wake up, are you going to feel any different?
I'm probably going to feel pretty different, yeah.
But I mean, is your gender going to change just because we've changed your body?
Probably not.
Probably not, because gender is defined in the brain, right? And what we know about brains is male and female brains are fundamentally different. We can do functional MRIs for hundreds of patients and sum them up, and the changes are consistent across hundreds of patients.
Up a little bit.
Fundamentally, female and male brains are just different, and that happens in the fetus. So you think, right, you have a presumably XY chromosome, and that determines your brain and your body. So how can someone end up transgender, right? God doesn't make mistakes, right? That's actually not true. Because in the fetus, if you have, for example, an XY chromosome at 4 weeks gestation, right, you're the size of like this big, your genitals already start developing. That's like 4 to 6 weeks of gestation when you barely even know that you're pregnant. But the brain doesn't start developing gender until the second trimester, and that's like 3-4 months down the line. And it's all under the influence of testosterone and estrogen, right? If you have an XY chromosome, the fetus will develop testes and start secreting testosterone. But anytime between the first and second trimester, if that testosterone is a little low, or maybe that person has a testosterone receptor that is not as sensitive, then that brain will develop along a different line. And in 0.6% of the population, even though you may have male external genitalia, your brain, for whatever reason, mom had a virus when she was pregnant, and the testosterone levels dropped in the fetus. Whatever the reason is, your brain then developed more along the feminine side. And I mean, I think that is established at birth. And that's how it happens, right? I've talked to thousands of patients. Every patient that I talk to, I'm like, when did you first know? And for most patients, it's not like I woke up yesterday and I'm like, you know what, I feel like a girl, I want to be a girl. It's not like that. For most patients, it's like I knew, Dr. Ting, I knew before I could walk, before I could talk, that I was different. And I mean, in my opinion, it's set at birth. Maybe there's some environmental influence as well, and it's immutable. I think in the same way that sexual orientation, it can't be changed.
I'd love to maybe explore a bit about a part of your work that I feel like goes unrecognized, which is, and I like the way you described it, this sort of psychosocial aspect, because I think when people think of surgeons, like when I got a surgery, like I met my surgeon for 2 seconds and he's like, "Hi, sign here." And then he left, and then I was like, I guess he's going to be good. I don't know, he has glasses, and that was sort of it. But but I feel like for you really have to treat the whole patient, right? Half of what you do is like this incredible technical sort of intersection of like technique, artistry, function, But the other part is really kind of working with the patient. And maybe if I know it's a huge topic, but if you could just explore that a little bit.
Right. Well, I mean, the surgeries themselves, I used to do microsurgical breast reconstruction. We would take skin and detach it from the belly, use a microscope, shape it into a breast after breast cancer. I thought those operations were complex. It's nothing compared to what I do now, right? We take a penis, testes, I remove the parts that I don't need, and then I make a vagina from that, and I make a clitoris that's still sensate, and patients can have an orgasm, and I make a vagina. And labia, aesthetically, it's mind-blowing, these operations. And yet, that is not the most difficult part of what I do. So the patients that I see, like my oldest patient was 77. When she came to see me, she was like, Dr. Ting, I've known since I was 5 years old, so I've waited 72 years for this operation. I've always known I was female. She'd been married to a cis male for 40 years. And, was living life as a female. She looked very female, completely stealth. She's like, this is just something I want for me. And I've waited my whole life for this. And in 2016, we started the first program in New York. It wasn't possible to get to surgery. She came in like 2016. She's like, I've waited my whole life. Can you do the surgery? That's a very hard burden to carry. Right? Patients now, they're on the internet. They know so much about me. We made a documentary. A lot of them have seen this documentary. When they walk in, I've had patients like break down in tears. I can't believe I'm seeing you in person. And that, to like carry all these expectations on my shoulders, that is an incredibly heavy burden.
With having interacted with so many different patients in such an intimate way, what's something that you wished the people here, but also the rest of society recognized that you could sort of share?
Well, I just think transgender people, they don't, it's a generalization. They don't choose to be that way. It's not a choice. It's something you're born with. And people who are trans, they go through life living with a body that is just very foreign to them. They hate their bodies. Imagine if you woke up one day and your penis was gone and you had a vagina. It sounds comical, but it's a horrible thing. 44% of transgender patients try to kill themselves, right? It's not a choice. It's the way you're born. And we have this opportunity with this technology to help patients' bodies align with what they feel internally and to reduce this distress that patients feel.
The last question I want to explore, you talked about this a couple of years ago with an interview that we did, which I thought was pretty beautiful. You talked about how, as a double bassist, growing up in New York, you'd go to the New York Public Library and you'd check out all this cello music and then play it for the double bass, which is not easy to do. But you said that you felt often like an outsider being a double bassist, and also being, just because of your socioeconomic background and the way in which you grew up, but also just musically, your life, you felt that you didn't always fit in, and you felt that musical experience kind of allowed you to connect with your patients in a kind of unexpected way. And maybe you could just tell us a little bit about that.
Well, that's pretty intimate, but yes.
Sorry.
Yeah, absolutely. I was always the outsider. I grew up in Queens, first Asian family in our school, and you know what? We were teased mercilessly. So I grew up with the experience of being the other, and when I first started doing this, I just recognized a part of me in my patients, and people just want to feel accepted. They want to feel authentically themselves, and doing this gave me the opportunity to help patients do that.
Well, thank you very much, Dr. Ting.
You're welcome.